They're hailed as frontline heroes, doctors and nurses saving lives during the pandemic.
But as KXAN investigator Matt Grant reports, healthcare workers are now facing a new concern: growing threats of violence.
For some at Del Seton Medical in Austin, a sense of safety shattered. These photos sent to us by a viewer who said they worked at the hospital, showing what UT police confirm. Someone fired a gun at the glass walkway around 9 a.m. on the 4th of July. No one was injured or arrested.
These acts of violence are despicable.
John Rigi says he isn't surprised. Formerly with the FBI, Rigi is now a national advisor for cybersecurity and risk with the American Hospital Association, a trade group representing nearly 5,000 hospitals.
Almost all hospital CEOs I speak to across the country now say that, along with cyber threats, physical threats of violence against staff is a top risk issue.
6 weeks ago, we requested calls for service from Austin Police for all area hospitals. We've yet to receive them, but a study in the National Library of Medicine found since the start of the pandemic, 44% of nurses nationwide reported being subjected to physical assault, 68% verbal harassment.
Unfortunately, many healthcare workers now believe that sustaining physical attacks or assaults or threats or intimidation are now just part of the job.
Ascension, the parent company for Del Seton, tells us all managers were notified of the incident and advised to update their teams as needed. We maintain a security presence at all our hospital facilities and continue to follow proper safety protocols to protect our associates, patients, and their families. In an unrelated incident, the hospital was placed on lockdown in June. According to police, 3 suspects, one armed, ran inside the hospital and were arrested following a drive-by shooting. That same month, a mass shooting at a medical complex in Tulsa, Oklahoma left 5 dead.
Send the first ambulance you can get.
Last year, a gunman at a health clinic in Minnesota left 4 injured and 1 killed. And Austin pediatrician Dr. Catherine Lindsley Dodson was murdered at Children's Medical Group during a hostage standoff. The rising violence prompting the American Hospital Association to send this letter to U.S. Attorney General Merrick Garland, writing, "For medical professionals, being assaulted or intimidated can no longer be tolerated as part of the job. This unacceptable situation demands a federal response." Following the gunshot that hit the bridge at Del Seton, a person who identified as an employee sent us photos from an internal presentation showing the hospital is stepping up security, now using 24/7 metal detectors and bulletproof glass in the emergency department, hiring more security and staffing the garage with a dedicated officer. Ascension would not confirm or deny any new security measures. In Washington, D.C., a new bill, the Safety from Violence for Healthcare Employees Act, aims to stiffen penalties, making assaults against healthcare workers a federal crime. It was sent to the House Judiciary Committee in June. The AHA says hospitals across the country are beefing up security, surveillance, and active shooter training as a profession taught to do no harm adapts to a new emergency.
Dealing with the pandemic, dealing with cyber threats, the last thing they should have to worry about is threats of violence.
In Austin, Matt Grant, KXAN investigates.
An article written by the Association of American Medical Colleges attributes increased aggression in healthcare settings to confusion over care, frustrations amid staffing shortages, political and social issues, and mental health disorders. In Texas, during the last legislative session, several bills failed to pass that would have allowed patients to carry handguns in hospitals. The Texas Hospital Association says healthcare settings are simply no place for guns and will work to prevent that.